Hi, we're all very busy when we provide feedback to the fellows. So today I would just like to briefly discuss in the next 5 to no more than 10 minutes the 1 minute preceptor strategy and another strategy called SNAPS, in which we provide quick feedback to our fellows during case discussions. The 1 minute preceptor consists of four steps. The first one is a commitment by the fellow to learn and to assume responsibility for what's going on with the patient. Second one is to probe the fellow for the supporting evidence that led to the differential care management plans of the patient, etc. Then the third part would be teaching. Finally, we want to provide feedback to the fellow and tell them what went on right and what things could be improved. So the first part of the 1 minute preceptor is the commitment, and that refers to the student, the resident, or the fellow. So after the student, resident, or fellow presents the case, you expect them to commit to discussing the patient's diagnosis, differential diagnosis that is, the patient's testing, and the patient's management. All of these things are expected at the level of a fellow, but you may not encounter them at the level of a resident or student. And you should encourage these to occur so that they start to tell you what they think about the patient. It's important that while the trainee is presenting, we should try not to interrupt the case presentation unless it's really quite off, of course. And after the presentation, we should also try to avoid too many questions regarding the presentation, if at all possible. Now, commitment is both ways. There should be commitment from the trainee to discuss the patient's diagnosis, testing, and management, but there should also be commitment from the faculty to provide teaching and feedback. So after commitment, the next step in the 1 minute preceptor relates to probing the trainee for supporting evidence. And we should ask questions such as, what led you to this decision on the patient's differential diagnosis, patient's management, etc. So that we can explore what the thought process was of the learner and try to correct those things that do not seem quite right. The next step would be to teach general rules, and that involves explaining our rationale for doing what we're doing. We just don't want to say the patient needs to take this X or Y medication, but why does the patient, or why we think the patient requires this medication specifically. The last part is to reinforce what went right and correct mistakes. And one of the things we can do for this first is the ask and tell strategy. We should first ask the fellow first what he or she thinks went right about the case and what could be improved, and go from there. So these are the steps on the 1 minute preceptor. But this is not the only strategy we can use to teach our fellows. Indeed, the next strategy is the SNAPS teaching strategy, which is an acronym for summarize, narrow, analyze, probe, plan, and select. The first thing is for the fellow, after they have presented the case, to succinctly summarize the history and findings. Then you want to narrow the differential diagnosis to just 2 to 3 relevant diagnoses. We don't want to have our fellows tell us the entire differential diagnosis of gastrointestinal bleeding, but rather what they think is going on. The next step would be to analyze this differential diagnosis and why did the fellow choose X or Y among the differential diagnosis. We should do the same as we did in the 1-minute preceptor. We should probe the trainee to ask them why did they think the way they did to arrive at the differential diagnosis or patient's management. After that, what is the plan for the patient? And then finally, when we provide feedback, we can also select an important aspect of this case for the self-directed learning. So after the case presentation, we can say, well, this perhaps is a topic that you may want to read more specifically, and we want to really narrow that to as much as possible. Don't tell them to necessarily just read about inflammatory bowel disease, but read about one specific aspect. I mean, on the case. Finally, one thing I want to let everybody know is when we provide feedback, it is important to, whenever we see something that the trainee is doing, we should say something back to them. Again, it could be something positive. It could be something negative. It all depends on the circumstances. But it is important that we provide feedback. And by do something, it depends on the circumstance, of course, but by that I mean report it in the evaluations, which would be another topic of discussion in one of these mini lectures I'll be preparing.